Thank you very much.
Both are chronic problem and both ultimately ends to shorten the life, may end to shorten the life if not managed properly. So I will give more importance for prevention of these conditions, that is the asthma and the diabetes. And the prevalence of the both has been shown similar in this paper and in its further study. And the diabetes is a disease which affects multiple organs of the body, likely to also affect the lung and its function. Now, asthma in pregnancy. Now, in our day-to-day general practice, the woman of childbearing age group asked the physician whether she can have pregnancy. Now, this question has to be answered by the doctor concerned. Now, we can say that these patients of asthma, that is the ladies, they can have pregnancies provided they take more care and frequent visits to his physician and proper management of asthma during antenatal care, and especially in the later part of pregnancy and also during labor. Now, bronchial asthma and cardiovascular disease. Now, it is very important that we used to say whether it is differentiate whether it is cardiac asthma or bronchial asthma, and we ought to differentiate from the history, clinical features, and the physical examinations, and they must give more importance to the past history, take laboratory history, and then you can come to a conclusion in most of the cases whether it is a cardiac asthma or it is a bronchial asthma. And the certain drugs cannot be given in case of cardiac asthma. Especially and certain drugs cannot be given in case of bronchial asthma if both diseases are present in the same patient. Now, when you suspect some degree of cardiac involvement in the dyspnea of a known case of bronchial asthma, especially in old age, it is diuretics is helpful. If you add diuretics, that reduces the asthma, dyspnea in most of the cases, and we sometimes practice use of diuretics under care in such cases. Now, you should go further to investigate whether what is the cause of dyspnea in such suspected cases where the bronchial and the cardiac elements either singly or both may be present as a cause of dyspnea and cause confusion and defects in management. Now, management of childhood asthma. As you know, these children very frequently develop viral infection and bronchiolitis. And so we must exclude bronchiolitis or association of bronchiolitis with the dyspnea and treat bronchiolitis in dyspneic children who may also have asthma associated.
Professor Mustafizur Rahman sir and Dr. A.K.M. Rajas, given our appreciation to our co-chair S.M. Mustafa Jamal. Dr. Khaleda Begum. Thank you, sir.
His graduation from Kolkata and did MRCP in 1996 from UK. He worked as consultant respiratory physician in UK and he has a lot of publication and he is expert in pulmonary intervention and pulmonary intensivist. So he will speak on smart therapy, steroid as maintenance and regular therapy in the treatment of asthma. So I will request in this session to chair Professor A.K.M. Samsuha, former Director, National Institute of Disease of the Chest and Hospital, and Professor Mirza Muhammad Hiron, Director, National Institute of Disease of the Chest and Hospital, and in this session, I will request Dr. Muhammad Anamullah to take part as a devotee. So I will request now Mr. Hindol Das Gupta to talk on smart therapy. I think you will enjoy this session.
So we are going to start our session. We are already more than 1 hour behind the schedule.
Thank you, Chairperson sirs. I must thank Bangladesh Asthma Association and in particular Dr. Islam to have given me this opportunity, and this is really an honor and a privilege for me to come and stand in front of you. It's not because I'm standing in front of you and delivering a lecture that I consider myself as part of you, one of you. Because all my ancestors, including my parents, are from this land. And when my parents, my father is from Phulipur and my mother is from Gaimanda. And when they refer to this land, they always refer it as Shonar Bangla and not just Purbo Bongo or Bangladesh. They always refer to it as Shonar Bangla because they feel that this is where Shonar Bangla is. With this, I have a difficult task to perform, especially I've been told that I've got a very short time and I have to catch a flight as well. What I'm going to talk to you about is the present day treatment of asthma, and unfortunately I did not know that formoterol preparation is not available in Bangladesh, but I'm sure and I'm almost certain that it's going to come